to Kenya, insurance coverage plans or service coverage changes are on their way if Kenya's parliament has its way. Kenya's National Hospital Insurance Fund, NHIF, will stop paying for treatment of chronic diseases such as cancer, diabetes, heart and kidney ailments in private hospitals if Parliament approves changes aimed at reducing payouts. Joining us to discuss further, Sanyade Okoli, CEO, Alpha African Advisory. Good morning. Thank you so much for joining us. Yes. I want to start with Kenya. I know, bearing in mind, this is still going to go through Parliament. What do you think the impact would be on stopping health funding for chronic diseases for private hospitals?
Well, clearly they're struggling.
Yeah.
I was reading a statistic that said that for the treatment of dialysis, the NHIF's bill had tripled between 2017 and 2021. And analysts or experts already foresee that certainly the middle class are going to be spending a lot more on healthcare over the next 5 or so years. And that's simply because of change in lifestyles, what they're calling these lifestyle diseases, unhealthy eating habits, and lack of exercise. So it's an issue. Essentially, the population is getting more and more ill, especially with these chronic illnesses.
Right.
And NHIF had reached an agreement for private hospitals to treat some of their patients, but I think the bills just ballooned and they feel that they can no longer afford it.
There's talk of, I have to say this carefully because it sounds so harsh, there's talk of folks on the informal sector in Kenya freeloading off of, I don't have any way to say it, freeloading off of the insurance coverage that they're getting from private hospitals. And so that's also, what do you make of that? They're human beings as well. So how do you...
Well, you've got the NHIF, which is compulsory.
Right.
So they make their contributions. And they will utilize whatever facilities that the NHIF does put in place. So it's not a wonder, let's put it that way, especially with the issues with the government hospitals, with the overcrowding and lack of facilities, et cetera, et cetera. Kind of makes sense.
You made reference to Kenya's budget being, stretched and so on. Well, what's the solution here in an election year? Is it higher taxes that go towards funding healthcare, or how?
Well, I think before higher taxes, I think there are a few solutions that, in their shoes, I would explore. One is I know they've just increased the contribution, the NHIF contributions, but rather than just a sort of standard contribution, is there merit in perhaps a risk-related contribution, which could actually encourage healthier lifestyles? 2, how hard could they negotiate? Because if they take away essentially this business of some of the private hospitals, they will suffer.
Right.
And some of these private hospitals would have made investments based on a certain volume
that
of
they
business.
Expect from, right.
Yes.
Right.
And if they take that away, that causes issues. So perhaps there's an opportunity to negotiate with some of those hospitals, especially the ones that will be most affected by this change. And then a third solution could be some kind of PPP, where there's a partnership where you have, not a hybrid, but hospitals that have better facilities than the usual government hospitals, especially for these chronic diseases,
right,
but delivered at a lower cost point than the current private hospitals, almost like a charter government hospital. Just different ways of playing around with the issue.
They should tap you as an advisor.
Thank you.
Alpha African Advisory. It's an election year.
Yes.
Does this even pass through Parliament with a bill like this?
It's going to be tough, right?
Yeah.
And it really depends on. I don't know all the details of exactly, sort of who's in position, who's in power, how much longer they have, etc.
Right.
But you're right. It's a tough year to try and pass something like this that is going to affect the masses.
Right. To Egypt, we've talked about Egypt a lot here, exports going up and so on. I guess, so what do you make of the whole technology transfer conversation with AstraZeneca and so on?
It makes sense, because remember we also spoke about the healthcare, shall we call it industrial park that they had created. And we've all seen the issues where vaccines and medical, healthcare, drugs and pharmaceuticals, et cetera, when it's not being produced closer to where the people need it. So it makes sense.
Is there an automatic link between technology transfer and economic growth, you think?
In theory, yes.
Yeah.
It should happen. But, transferring the technology is one thing, but having the knowledge and the wherewithal to be able to utilize that
So infrastructure, right, of the recipient?
Everything.
Right.
Infrastructure, skills base, etc. To be able to effectively harness that technology that you're taking on board.
Africa doesn't have a choice here, right? These vaccine manufacturing hubs, it can't just be Egypt. Someone has to be. Everybody else has to do this. It's exactly what I'm asking you. Isn't that what we have? We have to see this scale across the continent.
Yes, but I think why Egypt keeps having that conversation, because Egypt were actually prepared.
Right.
Because they made necessary investment even before the pandemic. So that put them in a better position to be able to have some of these discussions. But yes, we absolutely do need greater healthcare capacity across the continent.
Gotcha. Ghana, what do you make of the decision to tax these online businesses in order to try to raise money?
Well, to be fair, it is a global issue. This whole concept of digital tax and the concerns that some of the multinationals keep trying to flow profits into lower tax jurisdictions,
right,
and using all sorts of accounting treatments, shall we say,
right,
to minimize their tax bill. But it's not that simple, which is why I think it was last year the EU had to put on ice an effort they were making on this issue.
Right.
And then by October, the OECD, together with the G20, came up with a global framework as to how to treat this whole digital tax. So I'm just hoping that what Ghana is doing is based on that framework, because the reality is it does have its complexities, and it's not something that one country in isolation can think they can address.
Right, by themselves.
Yes.
There's also Ghana is also looking at, still on the same tax issue, they're looking at having some tiered tax reliefs for their citizens. It looks like they've recognized that raising taxes hurts people's pockets. So what do you make of that?
Well, it makes sense, because I would expect on their behalf to have two things. One, to widen the tax net, because when people think that the tax basis is fairer, then they're more likely to come into the net. But two, greater compliance, because there's no point just increasing your tax rates where you have low compliance. So it makes sense, and hopefully it's effective for them.
Finally, and this is something here in Nigeria, the informal sector, the folks who aren't formally recognized, is that still a significant challenge, trying to get them into the net so that they can be taxed? A barber on the side of the road, or a guy who fills the air in people's tires, folks like that, how challenging is it to get the informal sector formalized?
I know that Ghana's compliance ratio is higher than somewhere like Nigeria,
right,
but it's still not where they would want it to be. So yes, absolutely.
Interesting developments across the African continent, and we always, as usual, thank you so much for joining us to discuss. Sanyade Okoli, CEO, Alpha African Advisor. Really appreciate your time.
Thanks.